Sue has sent in a question which is apparently for you, David. She appreciates this is very specific, but says, I've got 2 patients who are bipolar. Do you have any tips for how to work with them? For example, one goes on mega shopping sprees when hyper. She's also less able to take advice on osteopathic stuff when she's like that.
Yeah.
Should she alert relatives? Should she ask the patient more? Should she butt out and accept that she's got no training in dealing with this?
There's been bipolar is one of the areas where there's been really strong progress in self-management and peer support. So there will be Bipolar UK is a really good organisation that it's worth putting anyone in touch with. There are a lot of people with a bipolar diagnosis who are really skilled at understanding and managing their own cycles and sharing those skills and techniques with others. So there is I mean, I don't know how well established self management practices are in osteopathy. They have their roots in chronic pain management and arthritis, and some of the best models of self-management developed by Stanford University in the States come from arthritis, diabetes, and chronic pain management. The bipolar world is really very strong in self-management and peer support, and I think people understanding those cycles and planning for them, there's been huge progress in, and I think probably the best thing you can do is signpost people to Bipolar UK and similar organisations. Where people can talk to others, share those experiences and share those coping strategies.
It is one of the most difficult ones to diagnose, though, isn't it?
It is.
Because of the differences between the mania at one end and the depression at the other, and the gaps between the two.
Absolutely. And but there's also been some really interesting work. You talk about spending habits. There's been some really interesting work with credit card companies and algorithms, and actually identifying spending patterns. And there have been some really good examples of working with credit cards that will selectively stop particular spends without embarrassing you. So they won't stop your supermarket spend, but if you try and buy the 3rd ticket in a row to Acapulco, or as a friend of mine did, buy an ocean-going yacht. Those kind of spending patterns can be. Do
you know? I think my credit card would stop me buying an ocean-going yacht without having to tell it to do it.
Yeah, well, this friend of mine was very senior in PR. She had a phenomenal credit card limit,
right?
But no use at all for an ocean-going yacht,
right? So this is something that a sufferer would have to actively seek out through their credit card company.
Oh yeah, absolutely. And I don't know how widespread it is, but it is one of those things where there are likely to be. We talk about algorithms and artificial intelligence starting to contribute significantly to clinical practice in a wide variety of areas.
Interesting. I've not heard of that.
Yeah, it is one of those areas because, in the general scheme of things, those spending patterns are quite simple to pick up because there is quite a disjoint between those rhythms of how your spending behaviour is and how
Is there a regular rhythm to bipolarity?
Most people will be aware of their kind of peaks and troughs, and I wouldn't say you could set a stopwatch by it, but they'll be aware of those kind of. And one of the things that's made self-management so effective in bipolar is people learning to recognise their own ups and downs and intervene and get support from others when they are at exactly the right point. And again, friends of mine describe it a bit like surfing because as you get high, you get very productive. You're getting hyper sensitive to a whole range of things, and there is a point where that you have to kind of switch between enjoying that buzz and not getting into that getting into that destructive phase, that destructive behaviour. But that's a really personal thing that you can people can be trained to identify themselves much more effectively. But it is very much about then sharing that information with people around you.